just a very brief introduction. I don't know how many of you have been to one of my talks previously, but just to mention, my background is I've had two careers, one in biomedical sciences, so it's teaching in medical schools, teaching biomedical scientists. But then about 30 years ago, I trained to be an osteopath and completed a number of extra courses and have trained in a number of different therapies, another one being naturopathy. So I come to a subject from two directions, which is really looking at the medical side, but also looking at, are there any alternatives, any other approaches that may be of benefit? So as with all my talks, that's the approach I'll have. So we will look at things a little bit scientifically, medically, but we'll also look at, well, are there any other options at all with, for example, today we're looking at diabetes. So that's the approach we have. My background, I've got science training, biomedical training, research training in medical research, and I've been a lecturer for most of my active life career. So yes, and I'm addicted to teaching, hence even in retirement I still give talks. Okay, so I'm going to go over to the presentation now, and hopefully reasonably smoothly with a minimum number of clicks, and hopefully you've got a title slide in front of you which says type 2 diabetes, how can it be managed? So to start with, though, we really ought to talk a little bit about, well, what really is diabetes, if we're going to be talking about it for the next hour and a half or so. Well, diabetes, generally referred to as sometimes in medical texts as diabetes mellitus. The mellitus refers to one of the earliest possible tests for diabetes, which, believe it or not, was the sweetness of urine, because when somebody's diabetic, their urine is sweet because the sugar, of course, is not metabolized or broken down. It's excreted. So bit of history there with the term diabetes mellitus. What is it? Well, it's the blood sugar level becoming too high. And I've put down, unfortunately, there's two sets of what we call units. So there's units here, these are milligrams per deciliter, very inconvenient terms and units. An alternative used by some medical practitioners is in millimoles per litre. That's what these symbols mean. But basically what we're talking about, I just wanted to give you a number, because when we refer to numbers later, we get used to whether the number looks high or low. But basically, with diabetes, we're looking at a person's blood sugar level becoming too high, and these are two different values. These values are different types of units mathematically, that we can use either of these, and anything, this little v on its side means greater than. So when a person's blood sugar is greater than 100 mg/dL, that's milligrams per deciliter, or greater than 7 mmol per L, which is millimoles per litre, either of those terms on a pathology printout would mean that diabetes would be suspected. Obviously, these values can be low, higher, and vary, but that's all part of the picture, obviously, of whether, in fact, the body can manage to control blood sugar levels. There are two types of diabetes. We're going to be looking at one specific type initially. We will, though, just refer to these other types in passing. Type 1 diabetes, when we're talking about type 1, sometimes referred to as insulin dependent or juvenile, because most frequently onset is juvenile, when someone is a child. And what happens is, unfortunately, the body's immune system attacks and destroys the cells in the body that produce insulin, which is insulin, remember, is the hormone, the substance that helps to control glucose level in the body. And unfortunately, in type 1, what's happened is the immune system has attacked the cells producing the insulin in the pancreas, and that means obviously insufficient levels of insulin are produced. So, of course, the treatment would be the management of type 1 is using insulin injections and, of course, careful control of diet. And the most likely causes, the reason why the body starts attacking the pancreatic cells, the cells of the pancreas, it very often can stem from a genetic predisposition, but more often it's viral factors, that some sort of virus has caused the body to react to try and attack the virus, but unfortunately might, in attacking the virus, unfortunately damage the pancreas and the cells that produce insulin. So that's type 1, and we're really not going to spend much time on that, because with type 1, although the symptoms are very similar to type 2, obviously the control of type 2, which we're coming on to now, is something that we can look at and we can influence. So type 2, the body's cells do not react to insulin produced. So although the body's making the insulin, the body's not reacting to the insulin that's being produced. And it very often means the body tries to produce more insulin initially, but of course, unfortunately, to no avail, because the body just doesn't respond in the way that it normally would do. The medical management for type 2 is diet, and we're looking some detail at that, because of course, if we were trying to delay the onset or to avoid the onset of type 2 diabetes, if diet is a way of avoiding it, then obviously it's really worth looking at that in more detail. There is medication for type 2 diabetes, metformin. Metformin is well established as the normal treatment. There are other drugs, obviously, but metformin is well established for managing type 2 diabetes. And type 2 diabetes now is so very common. In fact, if we were to really look at the numbers, recently having gone through a pandemic together, if you're really looking at something that is very clearly a pandemic, then type 2 diabetes is. It really is becoming a major problem. Part of that we see is because, unfortunately, a lot of life habits predispose people to type 2 diabetes. So it really is becoming a very serious problem, a very heavy burden on the health service, and obviously has significant effects on the health and well-being of patients. So there are, though, some aspects when we're looking at type 2 diabetes. There is a stage before the onset or classification as type 2 diabetes, and it's called pre-diabetics or diabetes, where there's no distinct signs or symptoms apart from we've got an elevated or a high blood sugar level. So no signs or symptoms. It's quite difficult to, in fact, diagnose unless obviously a blood sugar or a blood analysis is carried out, and it's found that, of course, the sugar level is high. So there is a pre-diabetes. I always think it's quite interesting when we compare this to something like blood pressure, because remember, with blood pressure, there's elevated levels, but there's also levels which are slightly higher above normal, and that's almost this pre-stage. And here with diabetes, we have this condition where we have elevated level of sugar but no symptoms. There's also diabetes during pregnancy. So high glucose levels can develop during pregnancy. That's gestational diabetes. It's actually given a diagnosis, specific diagnosis. Now, what have I put in the square in these brackets here? There's some evidence that gestational diabetes could be managed by a vitamin B6, and a dose which has been found in research to be successful is 100 milligrams per day, which is a significant quantity for B6. But it's quite interesting that something as simple as a vitamin seems to be able to ease or address gestational diabetes. Now, there is yet another, I just wanted to just mention these other types because there's another type of diabetes called diabetes insipidus. So it's quite complex, isn't it? We've got type 1, which obviously is the insulin dependent, type 2, which we're going to spend most of the time of the talk talking about. But just to mention another type, which is diabetes insipidus, is quite a rare disease. It has the same symptoms of diabetes. And as we'll see when we come on to the symptoms of diabetes are being very thirsty and going to urinate, going to the toilet very often. So you probably guess what that is about, is the body's got too much sugar in it. What does the body try to do? It tries to wash the sugar out. And in diabetes insipidus, it does the same thing. It's got the same symptoms as type 1 and type 2, which is you're very thirsty because your body wants to wash out that excess sugar. And by drinking lots, then obviously we go to the toilet a lot. It's caused by a hormone. We won't go into the details about it, but basically it's hormonal, a rare disease, but it does share the same symptoms. And obviously is always needs to be checked, if there's a diagnosis of diabetes. Now, if we look at type 2 diabetes, and that's going to be the focus, remember, of the talk this afternoon, we're really looking at a situation where glucose levels are high. But if we look at the various, levels that we can have, if we look at a blood glucose chart here, these are the units that we would use. But basically, the normal is the green. It's a bit like traffic lights. If we were to not have anything to eat and for a period of time, 12 hours, for example, then that's called a fasting level, and the fasting level between 80 and 100. If we then have something to eat after 2 or 3 hours, most of the food and the glucose has been absorbed, so the background level is between 120 and 140. But immediately after eating, there's quite a surge, because that's before our pancreas can make the insulin that's needed to help us control the circulating glucose in our blood. Now, that's normal, but if our ability to manage glucose is impaired, then obviously when we're fasting, the value is going to be higher. And so also after 2 or 3 hours, or that surge after eating is obviously high. And then we have the classification of diabetic. Again, fasting levels. So sometimes when the diagnosis of type 2 diabetes can be from a fasting glucose level. And if the value is quite high, above 126, above that value, then obviously could indicate diabetes. Or, of course, after eating, there'd be this very significant surge of glucose, and then it reduces, but still remains high. So you can see it's quite a challenge, really, to work out where you are, in the time that you've had since taking in glucose. But the diagnosis comes from how responsive your body is to that surge of glucose after you've had a meal or had a snack, if that snack had a lot of sugar in it. So let's look at the risk factors. What's the most likelihood of, in fact, those likely things that predispose you to type 2 diabetes. One of them is family history, but it's not the major one, because obviously, if we look at it, it's only about 10% if parents or siblings are type 2 diabetes. So, although there is it's not as strong as a pure genetic relationship where everyone would do. It's almost a familial tendency, But certainly, if parents, direct relatives, parents or siblings, brothers and sisters, etc., you find that it's a 10% increase. The big one, though, is obesity, and this is why type 2 diabetes is becoming a pandemic. 10% of the population, and increasing, and that's a significant burden. And the problem is type 2 diabetes is now becoming more prevalent in younger people. So it's not something where normally type 2 diabetes, you would say, well, people in their 60s and 70s perhaps. Now people in their 30s and 40s are getting type 2 diabetes. So it is becoming more a problem. How do we know? Obesity is a major relationship. BMI, body mass index. It's a very simple measure to try and get some idea of how much fatty tissue there is in the body. That there is a lot of questioning at the moment. The BMI is being used so often, but really it's not measuring what you need to measure when you're trying to determine whether somebody's obese or not. Because BMI, you can be very athletic and you'll have a high BMI, a BMI which is 30 or more. So it doesn't help us really work out, a definition of obesity. A better measure is what's called waist to height ratio. So if you measure your waist and then measure your height and work that out as a fraction or as a figure, then we find that if the value is greater than 0.5, then that's considered to be a better definition about what obesity is. So BMI is beginning to fade, although it's been used for decades. Waist to height ratio. And the reason why waist to height ratio is used is because it gives a better idea where the more hazardous fatty tissue is, because you probably realize the waist is where very often weight is put on, isn't it? So BMI is looking at the whole body, but really we need to know really how big the waist is, and the bigger the waist, the more fatty tissue there is. So waist to height ratio is now becoming more popular as it's seen to be a better measure of obesity. Other risk factors are if we've got a diet which has got lots of refined carbohydrates. Now, carbohydrates, remember, are the sugary substances we have in our diet. Highly refined. The refined ones are things like sucrose, the sugar that we put in perhaps tea or when we're cooking. Sucrose, those are refined sugars. And obviously, if we have a diet which is high in carbohydrates, which are refined, and low in fiber, then that's a risk factor for type 2 diabetes. So can you see already we are saying, well, look, if we want to reduce our risks for type 2 diabetes, one of the simple things to do is just look at our diet. And obviously, if we are consuming a lot of refined carbohydrates, then we obviously ought to try reducing them. And obviously, if we're not having enough fiber in our diet, we'll come back and talk about what we mean by fiber a little later. Then obviously, again, if we increase the fiber, then that's going to have a beneficial effect. So these are risk factors for type 2. And another series of risk factors are a number of prescription drugs. There's a number of prescription drugs. Hopefully, obviously, an individual patient isn't on a number of these drugs, because obviously each of them has its own contribution towards predisposing to type 2 diabetes, but glucocorticoids, which are steroids, thiazides, water tablets, and thiazide diuretics, statins, which are quite a common medication, and beta blockers for blood pressure. But it doesn't mean that if you take these drugs that you're going to develop type 2 diabetes, but it does mean that they could contribute to a predisposition of developing type 2 diabetes. So, for example, I work as a practitioner, seeing patients as, an osteopath, and of course with statins, sometimes a patient will present and you ask them about medication they're on statins, and they're also on treatment for type 2 diabetes. So it is a possibility, obviously, that the statins may have contributed towards type 2 diabetes. Remember, if you have concerns, always discuss it with your doctor. But prescription drugs, unfortunately, predispose very often to type 2 diabetes. We mentioned diabetes during pregnancy. Also, if the baby born is of significant weight, 9 pounds or more, I haven't put it in kilograms, but greater than 9 pounds, so a large baby can also predispose towards type 2 diabetes, as is diabetes during pregnancy. Do you remember we said gestational diabetes is a type of diabetes, and obviously after the birth there is a predisposition towards type 2 diabetes. Hypertension, with these things there's very often cross relationship. So if your health goes out of balance, hypertension, 140 greater than 140 over 90, we could have a whole talk on hypertension, but basically managing it, a general global figure of something greater than 140 over 90 is considered to be hypertensive. But it's contentious because if we look at hypertension history, it's varied. Some figures, some values much higher than that in the recent past were considered to be normal. The normal band is being changed. Right, race, African and Hispanic, it's almost a risk factor. There's a greater predisposition in African and Hispanic American. But one of the major factors, and again, we're looking, remember, in this talk, the things that we could do that would make a difference. And for type 2 diabetes, there's lots of research coming out that more exercise helps, trying to reduce the amount of inactivity, and particularly sitting. If the sitting's much more, so lack of exercise, lack of inactivity, or inactivity and sitting are all factors that we need to consider and things that we can do something about. And with exercise, any exercise improves the situation. So it's not a matter of you may have to make an enormous jump and become a marathon runner. It's really just, increasing the exercise, trying to reduce the amount of inactivity, and trying to reduce the amount of sitting. Okay, so let's look at, we've talked about what diabetes is, but what does it really mean? What sort of symptoms can we have? And I've already mentioned some of the symptoms that we're very often, in the case of diabetes, we're talking about sugar in the blood that the body doesn't want. So it wants to get rid of it very quickly. And the way it does that is and it's a good natural thing to do, is if it's in the body, it doesn't want it, it wants to wash it out. So how does it wash it out? It makes you thirsty, because by making you thirsty, you're going to drink lots of liquid, and hopefully that will wash it out. So good logical body that actually, of course, protects you from the damage that would be caused if that sugar continued to be circulated. So we get an increasing thirst, we go to the toilet, we have more frequent urination, And one of the original diagnostic methods for type 2 diabetes, remember, it was only probably 40, 50 years ago when this was probably going to be a test for diabetes, and that's the smell of the breath or the smell of ketones in the urine. So ketones in the urine, very distinctive smell, but also ketones in the breath. And that's due to the body not being good at breaking down sugar. So what does it do? It breaks down fat instead, and that produces ketones. So that's the origin of the ketones in urine from breaking down fat in the body. So that's a little cluster of symptoms. That first, that urination, and in the urine, the smell, or on the breath, the smell. And then there's the whole raft of quite general symptoms, fatigue, irritability. But the thing about diabetes is that it does affect circulation, and it does affect the nerves in the body. So things like sores heal slowly. So the healing is infected. Gum disease, infections of the gums, infections of the skin become more common. So there's a number of different factors there that if we look at them, they're the sort of thing you could associate with lots of different illnesses. It's when it comes with the thirst and the frequency of urination that obviously it begins to look very suspiciously like type 2 diabetes. And pins and needles, as I've mentioned, the sugar affects the circulation and affects the nervous system. So affecting the nervous system, we get pins and needles in the fingers and the toes. It's what we call peripheral. It's the nerves which are furthest through from the spine and the brain. And obviously these will be the fingers and toes. And that's where we feel it most. And it's one of the concerns about diabetes that obviously the sensation at the limits of our bodies are less pronounced. So sometimes when there's damage to those parts, we don't notice it. This happens with diabetics, that very often they can get cuts or sores or ulcers of the feet and the legs, and they won't notice them because they won't feel them, because the pins and needles or what we call paresthesia, the numbness, obviously affects that sensation. So if we put those symptoms together, although some of them look sort of less obvious, but together what they can do is, of course, affect the body's organs. For example, arteries can harden, eyes can be damaged, the retinal damage. And in the retinal damage, we can also have, in addition, in the eye, cataracts. The sugar damages the lens of the eye, hence the cataracts. And we can get nerve, as we've mentioned, the nerves are affected in diabetes. So nerve and kidney damage, but also poor wound healing. You know, the body is coping with obviously damage from the sugar on its tissues, and that means it's less able to heal. So we have the poor wound healing. Let's now look at, if we've got high blood glucose, what is it doing? Right now, to remember that high blood glucose is quite a normal thing, provided it's very short-lived. If we eat a meal, we can't expect our pancreases to suddenly produce just the right amount of insulin. It doesn't do that. It guesses at how much you're eating that sugar. So, of course, it does mean that initially, of course, the amount of sugar you've added hasn't been controlled. The control of its release hasn't been specifically correct. So initially there's not enough insulin, so we get what's called hyperglycemia. Hyper means high or more. So hyperglycemia is quite normal. In other words, after a meal, particularly we've had something sugary, then it's not at all unusual for the glucose level to obviously rise above a normal level. So it's benign, there's no symptoms, it's okay, but it should be short-lived. If it's for any length of time and the sugar's circulating, and more of it will obviously damage the tissues of the body. So long-term, greater than 180, so I'm using that figure of 180 milligrams per deciliter. And what happens is the glucose sticks to the body organs. Now, there's a chemical name for that. It's called glycosylation. But basically, what it just literally means is the sugar is very reactive and the sugar will stick to the organs and the tissues of the body. And by doing so, it can damage the organs. So that glycosylation, if it's short term, the body can heal and it will be fine. But if it's for long periods of time, as in diabetes, then obviously the damage can occur. So what happens when we have our meal, we get a rise in glucose. But if we do that time and time again, if we repetitively, have sweet things, raising the glucose level, what happens is our body almost gets tired. The insulin becomes less efficient. We reduce what's called the sensitivity to insulin. That's called insulin resistance. It means that even though the body's making insulin, the body's resistant to actually changing what it does. And that, of course, is defined as being type 2 diabetes. So the insulin isn't doing the job it really needs to do. Now, this little diagram here is to give some idea what we're talking about. So this is before we have our meal. So the starting point here, so we're just about to sit down, have our meal, and we start eating. And obviously, as we start eating, what happens is the glucose level rises because we eat more and more. And then, of course, our pancreas starts producing insulin. And when the insulin starts working in the body, the glucose level starts falling, right? But notice when it's falling, it's very often falls below what the normal level is. That's called reactive hypoglycemia, which means the glucose level is too low in the body. Now, this is quite normal, and it means that what will tend to happen is you probably guess you have your meal, very often you might feel a bit sleepy afterwards. And that's quite a normal reaction. But the thing is, it can mean you feel a little bit, this is about an hour and a half after your meal, that you can feel a little bit peckish and you want to eat again or drink a sugary drink again. So the problem with this pattern is the tendency to make you want to eat again soon after you've eaten. Now, for most people, this dip is not very large. But for people that continually drink sugary drinks or have sweet things, this trough area here gets deeper and longer, which means that, we get hungrier soon after a meal. So it's a natural thing to have, but it's a problem, particularly if we have diets that have consistently, refined sugar in them. So it becomes a habit, and the habit unfortunately means that people very often will have a meal and then they want something sweet after it. And you probably guess that's almost a characteristic of many diets, isn't it? That you have a savoury and then you have something sweet afterwards. And that sweet afterwards tends to take out this dip that you get from low blood sugar after you've had a significant meal. The trouble is, though, if you're snacking on sugary things, because that means in one day you could have a dip there and the person consumes something sweet, you get another peak, then another trough, and they consume something sweet again. Can you see? The trouble is that produces addiction. So in other words, this habit of trying to get rid of this dip means that there's a tendency to consume more glucose and you develop what's almost an addictive cycle. Let's look at the risk factors of high blood sugar levels. What risks are associated with high levels of sugar circulating in the body? And obviously one of them is type 2 diabetes, right? So of course, if you have high blood sugar levels, eventually what will happen is you develop type 2 diabetes, which is obviously the body trying to get rid of the sugar that's circulating. The other thing is, obviously, with a high blood sugar level, it means that there's more sugar circulating, and that sugar can be converted into fatty tissue. So one of the risks of high blood sugar level is, in fact, obesity. Do you remember we referred to it a bit earlier? And the obesity itself, remember, there's different ways of measuring it now to the way that was originally used. A risk of high blood sugar level is high blood pressure. Do you remember there's this interrelationship that we find with these different conditions, significant conditions which need managing, and high blood sugar gives rise to high blood pressure. Also heart disease, and also affects the efficiency of the immune system. The reason why I put these together, which to some extent is just bringing together what we've mentioned previously, is that these particular conditions, that is, that if you develop from high blood sugar, diabetes, obesity, high blood pressure, heart disease, and the immune system is less efficient, these are all what are called comorbidities. These are all things that work together to mean that you can develop severe infections. And the reason I brought it together is a historical point, and you probably remember this from COVID. Do you remember those that had type 2 diabetes had a higher risk during COVID pandemic? Those which were more obese, and those which were more obese, so very highly obese, had a very high or high blood pressure or heart disease. These are all what we call comorbidities, which means we can't actually respond to infections very well. So high blood sugar isn't just about, well, you know, what's going on with the sugar levels in our body. It's that we are undermining our immune system, which is the most important part of our body. As you probably realize from COVID, you know, this was known about right in the early months, right? And there was so much that could have been done that wasn't in protecting people that had these various conditions. So these are all comorbidities for severe infections. Let's look at medical approaches. So what's the medical approach around type 2 diabetes? We need tests for high glucose. That comes, obviously, our conversation we just had about fasting. Fasting is a reference point. So that's very often the best measurements are taken when we're in a fasting state, and simply on waking before eating. And if the value is greater than 7 millimoles per litre, then medically we'd have the diagnosis of diabetes. There is another measurement which is used for those that are pre-diabetic or even type 1 diabetic, is what's called HbA1c. HB stands for hemoglobin. A1c is that when blood or blood cells are exposed to glucose, they take up some of the glucose it sticks to them. And that sticking is permanent. So for as long as that blood cell is circulating, it's got that glucose stuck on it. So if we measure the HbA1c levels, it actually tells us how good someone was in controlling their glucose levels over the past 2 or 3 months. So diabetics, particularly those who are pre-diabetic, what we would have is testing their HbA1c levels over the past 2 or 3 months. So if the level is lower than 42, then they're considered to be normal. If it's greater than 60, they're diabetic. And in the range between 42 and 58, it should be under some sort of control. In other words, they're in this pre-diabetic phase. So it could be controlled, whether it's controlled by a diet or controlled by metformin. Obviously depends on the direction and the speed of deterioration. Metformin is the common medication, as I mentioned previously. There are side effects, sickness and diarrhea, but there's a slow releasing form which sometimes addresses the problems around sickness and diarrhea. Now, metformin, obviously, remember that type 2 diabetes and diabetes is becoming a pandemic. So a lot of people are consuming metformin. So sometimes when the metformin doesn't seem to work any longer, then if the metformin fails, then the person will probably have to have insulin, an insulin pen, so they inject themselves to control their blood sugar levels. But metformin, as I mentioned, really is a common medication now. So it's increasingly found in tap water. In other words, the purification process in sewage treatment works does not take out the metformin. So the metformin is increasing in tap water as a reflection of the number of people. Remember, this applies to a number of current common drugs that they're increasingly found in tap water because the sewage treatment doesn't actually manage to take them out. One point to mention here, because we're looking hopefully in this talk a little bit around, well, what can we do? Is there a way of breaking in here so that we can do something to try and avoid or treat type 2 diabetes? And one of the things to note is that sugar can be addictive, and it's related to, now GIT stands for gastrointestinal tract or gut. So in our digestive systems, we have lots and lots, billions of bacteria. And those bacteria help us cope with life, giving us nutrients, protecting us. But some of the gut bacteria are quite devious. And what they do is, if we feed them what they want, they give us a reward. It's quite natural, isn't it? You think, well, if you want somebody to do something, you give them a reward and they continue to do it. Well, gut bacteria or GIT bacteria literally do that. What they do in the body, right, not all of them, a very small proportion of them, but a proportion that obviously responds when it's fed what it wants. And we've got bacteria in our digestive systems that like sugar. So when we feed them sugary things, they give us a reward. And the reward they give us is a hormone that makes us feel good. So can you realize the damage that we have in our bodies, something that rewards us for consuming something that's probably going to damage our bodies? But obviously the bacteria do it because they want to be fed. So sugar is addictive, and this is the problem, because that hormone release the bacteria give us when we give them what they want, when we feed them sugar, then obviously because of that reward we get addicted to the reward. So that's the reason why sugar is addictive. It's only a relatively recent discovery, but in the discovery, there's been discussions to really say, well, what can we do to try and reduce the number of bacteria which are giving this reward, right? And that's the reason why giving up sugar is so, well, one of the reasons. There are other reasons, of course, but one of the major reasons why, of course, if we consume sugar, it's very difficult to stop, is that obviously we miss this reward. So, you know, when we're coping with taking in sugar, it really is an addiction. It really is something that is quite difficult. It's very, people say, well, look, I'm pre-diabetic type 2 diabetes. What can I do? It's so easy to say, we'll give up refined sugar. That in most cases will be a very major contribution. But you can't do it as easy as that, because the sugar itself, very often the reason why the person craves it is because they want that feeling of good that you get from the bacteria releasing the hormone dopamine, which makes you feel better. So what can we do? Well, we can try and rebalance the bacteria in the body. We can use pre and probiotics to correct what's called dysbiosis. Dysbiosis just means the bacteria population is out of balance. Dys means outside, so it's out of balance. So in other words, we haven't got the right balance of bacteria in our guts. What can we do to try and redress that? What we can do is to take something which is called a prebiotic and something else which is called a probiotic. So what are prebiotics? Prebiotics are particular foods that feed the good bacteria. So prebiotics will feed the good bacteria. So the ones that are releasing dopamine won't be nourished by prebiotics so much. Whereas the other bacteria which are healthy in the gut, as they're healthy in the gut, they will obviously help to balance. So prebiotics then, and these are things in common food substances, in onions, garlic, asparagus, chicory, leeks, a wide variety, vegetables, root vegetables particularly, rich in prebiotics. So they will stimulate the bacterial growth of the healthy bacteria, not so much, obviously, the ones producing dopamine. And then we have probiotics, and probiotics are additional friendly bacteria, and they help to rebalance the gut or gastrointestinal tract bacteria. And we're talking here about, for example, probiotics that we find in fermented foods, in supplements. And I've actually put some names of some probiotics: BioCult, OptiBac. They're both readily available probiotics, and over a period of time, they very slowly help to rebalance the gut bacteria, so you have less of the ones that are going to give you the dopamine reward. Lepicol is another commercial product. Lepicol is both pre and pro. It's unusual. It has prebiotic properties and pro. So we've got their situation there. Pre and probiotics help to rebalance the body. Now, I did mention one of your questions earlier on was about managing sugar cravings. And if we look at the sort of things, well, if we manage the sugar cravings, this will mean being very careful about sweet drinks, fizzy drinks. They're notorious, fizzy drinks, sweet drinks, because the sugar is in solution, is dissolved, which means the body absorbs it quicker. So fizzy drinks, sweet drinks are not good because they will encourage sugar cravings. You know, this swing that we get, this hypoglycemia, then obviously fizzy drinks, sweet drinks are the worst offenders. Other things, biscuits, cakes, sweets, milk, chocolate, processed juices. These are the ones that are filtered. If it's a fresh juice, it's less of a problem. If it's filtered, pasteurized fruit juice that you can get in supermarkets, etc., then obviously the sugar is more in processed juices, is more available, so less healthy. Eating smaller meals, certainly avoiding missing meals, because obviously if you don't have the surges, because remember a large meal gives you a big surge, and it will also give you a bigger hypoglycemic lower level as well. Spacing meals apart, eating starches. Starches are a form of carbohydrate, but the sugar is released slower. Remember, it's the fizzy and sweet drinks or the sugars, simple sugars, which really cause the problem about high glucose levels. Limiting alcohol and caffeine. Can I say that caffeine, as in coffee, coffee seems to be benefiting from more and more positive research recently. So it won't be long before I'd have to qualify that caffeine, certainly in coffee and black tea, is less of a risk. Caffeine, certainly in fizzy drinks, is an issue. And just to mention sugar cravings, fasts, which you may have heard of, they've been in the news a lot over the last few months particularly, but a few years as well, that there's different types of fasts. There's 5-2, where you have your normal diet for 5 days, and for 2 days you're having a fast, which means the size of your meals during that period is dramatically reduced. I mean, in pure terms, 5-2, the 2 could refer to 2 days where you abstain from food completely. But 5-2, there are different variations, but 5-2 is a type of fasting. It's called an intermittent fast because it's not a fast for any length of period, significant period. It's quite a short period. Another type of fast is a 16-8, 16 hours where you're not eating, 8 hours where you are consuming. And there's good evidence to show that if you want to regain your insulin sensitivity, in other words, reduce insulin resistance, it's always quite confusing, the terms, but if we want to reduce insulin resistance, in other words, try and avoid type 2 diabetes, there's a lot of research to show that trying a 5-2 or a 16-8 can actually give you a new sensitivity to insulin, and therefore avoiding type 2 diabetes. Okay, well, if that wasn't complicated enough, so we've got these values which are called glycemic index, which will give us a measure of how quickly the sugar is released. But the other thing we need to know is, well, how much sugar there is. Okay, if the sugar is released very readily, how much is there anyway to be released? And this is measured with glycemic load. And if we look at a comparison, you can see how difficult it is in nutrition. So if we look at the situation here, white bread, glycemic index there 71. So we really ought to avoid it because white bread, the sugar in it is quickly released. But then if we look at how much sugar there is, that's glycemic load, we can find that it's good. It's okay. So the secret there is obviously try and avoid eating a lot of it, because obviously it will produce quite a surge. Let's look at oats. Oats, glycemic index, they're very close to being good. And then we look at glycemic index, then we look at glycemic load, and we see that that's excellent, because although they might be a little bit sweet, the amount of sugar there is minimal. So you can see it's quite a challenge, really. If you look at something like rice, basmati rice, glycemic index means the sugar in it is released relatively slow, but there is quite a bit of sugar, so it's something that needs to be avoided. Watermelon, classic example. It's very sweet, watermelon, isn't it? So if you look at how quickly the sugar's released, it's very quick, but there's not a lot of sugar. So obviously you have to, a nutritionist or a dietitian would obviously need to work with the patient to work out obviously these particular values. Right, so if we're looking here at foods for glucose control, this is just to give you a little bit of a feeling about what sort of foods to consume. Because if we look at foods that will give us good control of glucose, obviously if we have a fizzy drink, we've got no real control because it just gets absorbed very quickly. But foods that give us control, there's some things that we can measure which will give us some idea of whether we can control the glucose that's in that particular food. And the measure is called glycemic index, and it's a measure of how rapidly or how slowly foods release their sugars. So it's, you probably guess, I mean, if we're talking about, you know, that nasty peak we get after eating a large meal, you probably guess that some of the food, if it's got a particular low glycemic index, it means the sugar is not going to be released very quickly. Whereas if we have something with a high glycemic index, it means that the sugar is going to be released very rapidly. And if we look at different values, there's been measurements carried out, because obviously if you're diabetic, one of the things you try and avoid is surges of glucose release, and a glycemic index is a measure of that. So it's quite valuable to help you in that control. So if we're managing type 2 diabetes, one of the things we can do is generally look at the food groups which are low in value, low glycemic index. So we try to have fruit and veg. Fruit, even though fruit has sugar in it, remember in the fruit, the sugar is bound to the connective tissue of the fruit. No matter how much you chew when you're eating fruit, you're never going to release all of the sugar. It's going to be significantly reduced. And obviously remember the basic rule, try to get those 7 servings or more a day if you can of obviously different fruit and veg. There's some breads and cereals which are low glycemic index. And as we see, a lot of breads unfortunately have a very high glycemic index, which means the sugar from it is released very readily. Beans, peas, legumes, all are benefit in terms of having low glycemic index. Nuts, if you regularly consume nuts, that helps. Fish, seafood, lean meats, poultry, eggs, all sources of low glycemic index. But recent research has shown, so although these measurements have been carried out, they've realized now that these glycemic indexes vary from one person to another because of the individual's own metabolism. Yeah, you probably realize there are books, reference books, with all of these GI scores and GL scores in them. And obviously from that, you can work out from the food you consume, really, are you challenging your pancreas to try and respond to a very high sugar load in terms of how quickly the sugar is released, or the load is very great if the glycemic load is high. So, it's a challenging area. Obviously, dietitians very familiar with these and should be able to give guidance in terms of those foods to avoid that will actually produce very significant swings in glucose levels. But let's look at, so just to mention though, is another way of trying to control glucose is looking at dietary fiber. So if we look at dietary fiber, there's a clear relationship that if the diet is low in fiber, then there's an increasing likelihood of type 2 diabetes. So just as we were referring a little bit earlier to, well, if we can try and balance what's going on in the bacteria of the digestive system, that can make a lot of difference in terms of the body and the likelihood of type 2 diabetes developing. But fiber has now been found to be, a very significant factor. It's one that is a bit of a surprise because dietary fiber is sometimes referred to, well, it doesn't have nutritional value. But of course, it's like most things in food, there's a reason why we eat these components. And certainly in foods which are rich in fiber, it's been found to obviously be of benefit in managing type 2 diabetes. And in particular, the fibers concerned, water-soluble fiber, and the water-soluble fiber increases, the way it's working is helping the body actually take up the glucose from the meal. So the fiber, in some way, the mechanism is not that clear at the moment, but the action is that fiber does have a benefit when we're trying to manage type 2 diabetes, and that is water-soluble fiber. It means that the muscle tissue, which remember there's almost half of our body is muscle tissue, it's a lot of muscle, and the advantage of that is it helps taking up the glucose, and the water-soluble helps with that. If we're looking for good sources of this water-soluble fiber, we've mentioned them previously, but just to mention a few more as well. Generally, obviously, the legumes, oats, nuts, seeds. Psyllium husks are a particular prebiotic which can be consumed. You can get psyllium husks. You can take them once a day, and they have a benefit of increasing your soluble fiber. Certainly very effective in treatment of constipation, but the other benefit is it's a prebiotic, so it will help your body control glucose. Pears, apples, and most vegetables, as I've mentioned previously, all good sources of fiber. And there is a recommendation. Again, it's possible to look at a diet and work out how much fiber there is, but the important thing is something in the order of 35 grams a day, making sure it comes from a variety of vegetables. Now, I did say my background is sort of a biomedical and complementary medicine, and one of the things I like to look at also is obviously looking at things like supplements. Are there any supplements that are known to be of benefit if you are developing towards type 2 diabetes, or might be even type 2 diabetic? And the sort of things that you can take, and I've put the quantities here in case you wanted to see, well, what are we talking about in terms of levels. So you can get multivitamin minerals. Zinc is a very important mineral, very important in the immune system, but also very important in helping controlling glucose levels. And zinc, the 30 milligrams per day, is a good dose. It's quite a high dose. It's not a very high dose, but it will ensure plenty of zinc to help with glucose control. The one that really certainly, there's a lot of research being done on this, is chromium. 400, now that symbol there means micro, which means 10 to the minus 6, but 1 million. But so it's a very small quantity, but 400 micrograms today of chromium. And chromium just makes the body's insulin appear to be more active. So as you probably realize, in managing type 2 diabetes, it's, looks and is sometimes very beneficial. Now, the one thing I usually say at some stage in all of the talks I give is, remember, we are all individuals. Our metabolism is different. We mentioned it a bit earlier, that even glycemic index varies from one person to another. So it is important to realize that for some individuals, taking these supplements, zinc, chromium, and magnesium, can make all of the difference, can really help to normalize glucose management. But in another person, another individual, they could take these things and have no benefit at all, right? Because their body doesn't need it, because their diet may already have these, or it may not be the issue that is the problem. So do remember, with things like supplements, they do work for some, but they don't work for others. And obviously, only trying them will find out. Fish oil, linseed oils. Remember, linseed oil is an alternative. If you're a vegetarian, then obviously linseed is a good source. And these are EPA and DHA are all types of oils. They're acids of oils, but they're basically oils. So something which has 600 milligrams of these two agents in them, two oils in them, would obviously be required. So again, for some people, this can make a lot of difference. For others, no difference at all. Vitamin C, that's to help the immune system, quite large quantities. If you were to try vitamin C, it's important to probably start at the low level here, probably a quarter or half a gram, not the higher value, right? Because vitamin C, the overdose, let's say, an excessively high value would obviously be 2 or 3 grams. Some people are a little bit more sensitive to it, so therefore a lower dose may be better. Vitamin D3, we've all heard of it, haven't we? That during COVID they were going to use it in care homes, and unfortunately they didn't in the end. But vitamin D3 really helps insulin receptors, and even quite low doses like 1,000 international units a day, vitamin D, that can make a lot of difference. Now remember, during summer it's not an issue, but in their care homes in winter, it's really quite important to actually have a vitamin D3 supplement, because remember, vitamin D3 is not only helps here with glucose control, but vitamin D, remember, is very important in terms of bone health in treating osteopenia or osteoporosis. Vitamin E, very important active vitamin, 400 to 800 international units a day, improves insulin action. And a particular soluble fiber called glucomannan, and glucomannan, 1 gram a day before the meal, and it helps with glucose control, reduces insulin levels, and actually helps in dieting, reduction in calories. So this is a relatively new addition, but again, strongly recommended if people are trying to regain glucose control. Another agent is carnosine, and that one helps with insulin, reducing insulin resistance. So we've got a number of agents here, and the thing to do is really, of course, get some feel about whether they have an effect for the individual. Let's just quickly recap on other lifestyle changes. Do remember, exercise is vital. And remember, exercise doesn't mean going to the gym. It simply means doing something more, being a little bit more active, trying to get those extra steps in a day. Even a few extra steps can make that bit of difference. and therefore obviously reducing the amount of sitting. Try to improve the diet. Try to avoid carbohydrates, especially refined sugars. Remember, glucose, fructose, sucrose, which is the normal crystalline sugar that we use, trying to decrease that intake. Sleep. I haven't mentioned sleep so far, but sleep does help in terms of glucose control. It will help. So anything we can do to try and improve the quality and the quantity will be a benefit. And stress. Stress, if we, again, stress management, trying to increase our time and quality of relaxation, that will be benefit. These are all things that have their effect in some way. Top of the list there, though, is exercise. That's the biggest thing to try to manage, but all these other components do have an effect. So there is good research to show, and as I say, I've worked in diabetic clinics with GPs, and there's a lot of research showing that dietary intervention, lifestyle modifications can prevent type 2 diabetes.